4 years ago or so, but I've always had like an itchy scalp as a kid, and I get a lot of rashes all over my body.
So it's mainly on the scalp?
I had, like, as a child, I always had like a really itchy dry scalp. Yeah, like obsessively itch it. But then I started in college getting like patches along my neck, and then now as an adult I get them on my neck and my eyelids. And
is it worse with sun exposure?
I don't know. I feel like it gets worse. It's just always there. They like don't really go away. The doctor has given me some creams, and if I put the creams on and then it'll go away, but as soon as I stop the creams, everything comes back and like flares back up. So
it's only here. The V and in the back of your neck.
Yeah, I think so.
What about your forearms, arms when you go in the sun?
No, I sometimes get rash on the back of my legs.
Okay.
Like bumpy rashes.
Is it itchy? Is it very itchy when it comes?
Yeah. I mean, not really. I don't know.
Is it dry?
Yes. Scaly.
When you get these bumps on your skin when we're like in Florida, is that anything?
Yeah, I get like bumps on my skin. Like sometimes I'll break out with like pinpointy looks. Not like this where it's like a crusty look. It's just like little dots that pop up on my skin.
Any sores in the mouth or nose?
Sometimes on my tongue, on the sides of my tongue.
How often?
A couple times a year I notice that. I take like every couple months.
Every couple of months, okay. Any inflammation in your eyes, pain, double vision, redness?
I actually went to an eye doctor this year because I started getting, all of a sudden I had like a bunch of floaters in my left eye, and then when I would walk, like hard, if I like stomped my feet when I was dancing with my kids or like doing any type of running, it would like flash to black in my eyes, and they said that there's like some type of retinal thing going on back there, and so now I have to see a specialist for that.
An ophthalmologist?
Yes.
Yeah.
A retinal specialist?
Yes.
But you don't have inflammation that requires steroid drops like uveitis, iritis, anything like that?
No, just dry eyes from my contacts, yeah.
What about dry mouth?
Yeah, I feel like I don't drink enough water though, so maybe that's why. But I do get dry mouth. I have my water with me all the time.
And fevers?
Not really, no.
When you go out in the cold, you have changing color of the fingers or toes?
Not that I know. No.
And you report diarrhea. Do you have blood in the stool? Have you seen a specialist for that? No. Is it chronic?
No, I think it kind of is either diarrhea or I have a hard time going to the bathroom.
It's irritable bowel?
Yeah, I had that in college, and then I actually went off of, like, had babies, and when I was pregnant, that wasn't as big of an issue for me, and then now it's back again.
Anybody in family with inflammatory bowel disease?
My mother.
My grandma.
Yeah, she had to have a
She was
colostomy.
celiac.
Celiac, so what, have you been tested for celiac? Negative?
Yeah, according to my doctor, yeah.
The blood only?
Yeah.
But you didn't have like a endoscopy? And do you have joint pain? So where is the joint pain located? It's everywhere, so this is the main thing.
Yes, this is the worst part. So like always in my hands, and this, I feel like it's really only started in like January, where I noticed I was like braiding my daughter's hair, and it was like hard for me to hold her hair. And then it went from that to like numbness and tingling, which then I went to the hospital because I ended up having impingement of my spinal cord from what they said degenerative disc disease in my neck. And then down my back I have like bulging discs and bone spurs, and they all the way down to my lower back, which also has a herniated disc. And that came on really suddenly, like from January is when I noticed the beginning of tingling and numbness in my arms, and then it went to my whole body, and I lost feeling from my face down, and I ended up, they thought I had a stroke, but I couldn't walk, and they did my thing. And
did you see a spine surgeon?
Yeah, and
Dr. Ng.
Dr. Ng was my.
Oh, so he did already a procedure?
Yeah,
yes,
they
he did my arthroplasty.
Myelopathy.
Arthroplasty.
When was that?
In February.
February
So I went in 1
So
month.
prior to that, did you have any neck pain or back pain? It was first time in your life.
Mm-hmm.
Well, it started just with the numbness. You
well,
didn't
I
have
had
problem
some
with
neck
the
pain, but like little babies, I have 3 babies in 4 years, so I always thought maybe like looking down at them and stuff, my neck was sore from that. And I've worked with little kids as a counselor, so I was always looking down. So I always kind of thought like the neck pain
It's because
was because I looked down so much.
Mm-hmm.
But I do remember always having back and neck pain and just kind
back pain since you were a child.
Mm-hmm.
And then, do you wake up in pain?
Yes.
And where is the worst?
My feet and hands in the morning, and shoulders, and neck.
Okay.
And then as I kind of get going, I feel a little bit better.
And the back is since childhood, but what about the others? Hands, feet?
No, the feet, the heel and the arches of my feet hurt as a kid, and I remember always needing slippers or shoes to walk around on the floor because I couldn't, like, as if I put pressure on it, it would like tinkle and hurt underneath my arch and feet.
Yeah, like plantar fasciitis?
Yes.
Uh-huh. And Achilles tendon hurt?
Mm-mm.
And in the morning you wake up with pain in the hands, feet, and back, right?
Mm-hmm. And shoulders.
Approximately for how long do you think you have that?
Well, the feet and
The hands and
feet
feet.
probably for a long time.
The same like back, or maybe later on?
Later on than the back, I think. Probably since I've had kids, so probably 5 years.
5 years.
Yeah.
And when you were pregnant, you felt good?
Yeah, I felt better.
In terms of pain?
Yeah, actually, well, I had like the swelling joints and I had the foot pain, but I don't really remember. I feel like I felt my best, honestly, pregnant. I felt better.
Did your wrists hurt though during
Oh,
pregnancy?
after I had my babies, I always had a big like issue with my hands and wrists. I couldn't hold them very well.
Tenosynovitis.
Yes, and like holding them, and I was like,
describe
yes,
new mothers.
yes.
So the psoriatic rash was diagnosed how long ago?
I think probably I've had like the spots and stuff for a long time, which was dermatitis.
I mean, you said in the scalp since you were a child, but what about the neck and stuff? And
probably college, so like 10 15 years. Yeah.
Okay, so did anybody address this pain all of these years? Because, or you didn't complain?
I didn't complain.
Yeah, because probably you have psoriatic arthritis, the way it sounds like.
Maybe.
Right? You wake up, and probably you had it for a long time. That's why you ended up all of a sudden having this numbness, but it was present probably for a long time.
Yeah.
Can I ask a question? Because we were talking about that. When they did her spinal arthroscopy, they did a lot of testing of her spine. And they showed the type of spine that an old woman would have at 33.
Yeah, because she had inflammation for a long time that led to that aspect on the X-ray and MRI, So psoriatic arthritis may look like osteoarthritis on radiologic studies.
And
because there is excessive bone formation due to inflammation, and it can lead to fusion, bridging osteophytes.
Yeah.
And then
Is what they said?
Well, I have a fusion on the top, and then the rest of it is degenerative to
and to degeneration.
Yeah.
Secondary to that.
And then she started getting these 2 thyroid nodules since February, and she's getting lumps on her fingers since then, and her wrist, and these were not there before.
A couple of lumps and bumps.
And then on her fingers, she's getting the same kind of lump that my mother and her grandmother had, her other grandmother, that looked like I'm not saying I'm not even saying
rheumatoid arthritis. I mean, patient may have more than one thing
type of
going on.
Yeah.
We suspect psoriatic arthritis due to the aspect of X-ray that you told me. I didn't even see. But patient may have two. More symptoms.
But do they get on the thyroid? I never noticed.
No, the thyroid could be also something separate. We'll see.
But those develop.
This is a surgery from the neck, right?
Yeah.
Well, this is the surgery from the neck, and then since then I grew 2 large nodules on my thyroid, and then.
And did they do ultrasound?
They did. I have to go back and get it because it was undisclosed or like
inconclusive.
Yeah, so I have to go back, but they didn't want to do it right away because it hurt so bad.
They hurt?
When they did the extraction of my thyroid.
They had to extract.
They did the fine needle biopsy? And how? What did it show? The
It
fine
just,
needle.
so one is not
Non-coagulated,
issue, yeah,
Mhm.
and the other one they're more worried about because it's fluid filled, like so they're gonna do another test in October. But
Did you see an endocrinologist?
yeah, Dr. Esquardo.
Okay.
Yeah, he's really nice.
Yeah, he's very nice. Did you do like? Did they do an uptake, thyroid uptake?
Yeah, and they came back pretty normal.
Yeah. Okay, so you are in good hand that
Yes.
you see endocrinologist, right?
Yes.
Probably that is not related with the hand.
Just
Yes.
something
No.
And
different
like
No.
I have a lot of swelling here. Like I don't
in this shoulder.
both of my shoulder blades and then sometimes under my armpits.
And this is new?
Yes. Like I can show you better. But like
Right.
I get like really swollen.
Did you take any steroids?
Yeah, when I first had this inflammation of my neck, they put me on steroids for 5 days to try to see if the inflammation before my surgery would go away, and it flared up real after I was done.
But did you feel
Yeah.
better
Yes.
in all your pain? So
Yes.
that is also a diagnostic trial. This is inflammation, this
Yeah.
is inflammatory arthritis. I
Yes.
suspect psoriatic arthritis for sure, but
Uh-huh.
the question whether you have rheumatoid arthritis, we have to figure out. It doesn't really matter because we treat with the same kind of drugs,
Got
both
it.
of
Okay.
them. It's not like a crucial importance,
Okay.
but we'll see.
Mhm.
And in here, I don't know why. Did they do more tests? Did they do a biopsy from these swellings? Or?
It's just getting
No.
bigger too.
It like no, it does.
And
no,
what
it's-
Dr. Izquierda said, it could be from the thyroid. Or?
He did the thyroid thing like because it wasn't as swollen. This is got every time I feel like my joints like when I feel like I've been hit by a truck, I get like all of these rashes and then everything swells. And then it kind of tapers away and it feels a little bit better. And it's not as noticeable, but it's still kind of puffy
you
here.
may have other things, there are many things that goes with your symptoms, so like I will do the whole autoimmune workup. I know your ANA was negative, but I will do the whole ANA profile,
Okay.
see if you have any certain subtypes. Do you have any muscle aches?
And like I can barely hold my phone up. Like and I
Is this new?
can't- Yeah.
Yeah, your thyroid function was good.
Yeah.
Thyroid also can be associated with muscle ache,
Sure.
joint pain.
Yeah,
Yeah.
which I
But
have
the TSH was
Hashimoto's,
good.
yeah.
They didn't check muscle enzyme. I'll check that because if there is another connective tissue disease related with lupus named dermatomyositis or
Okay.
that can manifest with your
Okay.
symptoms like
Yeah.
this rash that
Yes.
you have on the eyelids.
Mhm.
And here on the v-neck, it's on the sun exposed area. Usually psoriasis gets better with sun exposure. Did you notice an improvement with sun exposure in this? Psoriasis is mainly a clinical diagnosis. The biopsy will be inconclusive, like the one that they did for you. It could orient you toward the diagnosis, but it's not for sure.
Yeah,
that,
okay.
So, who is your dermatologist?
Dr. Bouchard, Jessica Barchard, I think her last name is. She's from Fayetteville.
Yeah. It's
she's-
with dermatologist associates.
Yes.
Okay, yeah. So, you said no fevers. What about weight loss?
Not really. I feel like, if anything, I feel like I've gained weight. I don't know.
Shortness of breath. Is this new?
It feels like my chest is heavy. That is new.
Any cough?
I have like a dry cough.
For how long?
I would say a month. But I also feel like since the thyroid has grown so much, my voice will, I'll lose my voice a lot.
When is the next appointment with Dr. Izquierda?
November.
Okay. Did he check you for Hashimoto thyroiditis?
Which is what I
I think
have.
so, yeah, because my
I
mom has
mean, they did the TSH screen, but I have
No, the
Hashimoto.
thyroid antibodies.
No, I don't know.
Because TSH is a function. The thyroid antibodies could be positive before you have like an overt abnormality of your thyroid. You can detect the subclinical
Yeah.
when you do that,
Okay.
right? And that will be because this is an autoimmune. It's an indication that could be related with other autoimmune things.
Right.
You already have celiac in family. So that could be associated with celiac
And I have
You have?
Hashimoto's. I
Yeah.
have Hashimoto's.
and others autoimmune diseases.
Mm-hmm.
So
That
when
would
was
be-
the last
that would be a
TSH
good-
that was checked? When was the last
The
TSH?
endocrinologist did it, right?
Like, yeah, endocrinologist in July.
I have some blood work done in February
Mm-hmm. That was around my
Here.
surgery.
and something in May.
Yes, I
Here.
feel like every couple months I go into the doctor saying I feel horrible.
TSH was in May. It was normal. So
Yeah.
you had one in July and it was normal?
Mm-hmm.
Do you have enough energy to take care of your kids?
It's hard. I had to call my husband when I have these like bad days
Yeah.
and have him come home early because like I feel it's like 11 a.m. and I get hit by a truck and
Mm-hmm.
I feel like I can't even get on through the day.
Can I ask a question
Yeah.
about, we live in a wooded area, she grew up in the woods, and I know they did a Lyme test and it
Uh-huh.
tested negative, but is
Mhm.
there any way that this could be related to possibly having Lyme disease that's maybe tested normal on that test that they did, but that there may be other Lyme disease tests?
If she was tested for Lyme and your questions about tick-borne disease, yeah, there are other tick-borne diseases. If you'd like, I can check it.
And
Have
then,
you been bitten?
Not
well,
that I know
she
of,
grew up
honestly, but
literally
I've always
in the
lived in
woods,
the
woods, going in the woods.
Oh no, this. I
Yeah.
mean, it's not chronic. I mean,
Yeah,
you know,
no.
usually, yeah.
Yeah.
You get very sick if you have it, and then
Yeah.
So and.
Mhm.
Later manifestation will be joint pain. Isolated usually to one or two joints. It's not like everywhere. You know, the
Sure.
later manifestation.
Is there
But
any?
you know that if I can check the tick-borne disease panel if you'd like, but I think
don't know.
something else is going on right now.
Do you
so.
think she could be having any, and I'm just asking because as a mother I'm watching her kind
Sure.
of fade. Do you think there's any way she could be having a reaction to the materials from the arthroscopy because it's so neck localized that when they put these cages in February 28th and she started swelling up around that area and it's been chronic since then. Is there any chance her body's having a reaction to the procedure or the
It's a possibility, but
material?
it's hard to assume.
Yeah,
you
I
know.
know.
I think more so it feels like my body is like reacting to the bones, like
I don't know.
Yeah.
like
Yeah, I
trying
don't
to
know.
fight back.
Something's
But these are
fighting.
so coincidental. You
I
know,
know.
all of this.
So much swelling and
Definitely something is going on.
something's
So,
going on.
And so when you go into the sun, do you feel blister? Do you have blister or itchiness?
I used to get heat rash on my neck
And
as
you
a
get
kid,
the raised
and I
neck
get bumps on my
under,
skin.
on her skin.
So you are photosensitive.
Yeah, she gets bumps on her skin. I remember seeing those.
And any nail changes?
Mm-mm.
And you mentioned hair loss. Is diffuse or in patches?
It's like just like chunks of hair, not patches. I've lost hair here, and in my part that is noticeable. But like if I brush my hair, it's just like clumps of hair falling off all the time.
How were your pregnancies?
They were good.
No problems, right? Like
No.
eclampsia, preeclampsia, anything like that. No. History of DVT, PE, stroke, heart attack, anything, clotting
Mm-mm.
disorder.
No,
nothing
I did
like
have.
that.
I always had low vitamin D, which I always had to go on more.
Girls with celiac. I don't know.
Yeah, I always had
Yeah.
to go on extra vitamin D.
I will add to that, just make sure because
Okay.
of your strong family
Sure.
history.
Yeah.
Do you avoid the gluten or no?
What was that?
Do you avoid
Gluten.
gluten?
No. I used to avoid dairy
Mhm.
because that made my stomach upset.
Mm-hmm.
But I
Now
never
you
thought
have
about
kids,
gluten.
so probably you.
Yeah,
might
no, I don't.
avoid.
Although my husband's family, not that it's related to me, but his whole family has celiac. So when we do family dinners and stuff, we cook very celiac appropriate. But
Okay.
yeah.
And hearing loss. It's also new.
It's like a muffled sound in my ears. It's like feels like I have water in my ears for a long time, but I don't have any pain. It just feels like I'm wearing earmuffs, and I try to like pop them, and it doesn't go away. Mostly in my left.
Can you see over the examination? So you had TB? You had TB?
I did. On my lung, they found some residual scarring.
Oh, latent.
When I was a child, lesions from tuberculosis. Yeah.
Oh, in the United States usually is rare.
I know. My grandmother had it, and then my aunt had it, and I was exposed, I think, to my aunt.
Psoriasis. And you have psoriasis too?
I did. Yeah. I
Oh.
don't seem to have it like I did when I was a young woman. No, and a child, but it's definitely
You know,
gotten
some
better.
patient has
as an
psoriatic
old woman.
arthritis without a rash.
Yeah.
That's very challenging. The rash will start later on in life.
Mm-hmm.
Weird.
20%.
Wow.
Really? I didn't realize that.
Mhm.
Wow, that's crazy.
And it doesn't parallel, the activity of the skin doesn't parallel with the activity of the joint, you know, so it could be
Mm-hmm.
in different times, the
Mhm.
flares.
Mm-hmm.
But in your case, it seems like it's in the same time when the flare
Yeah,
is,
it does.
the rash, right?
Yes.
Okay. Yeah. Do you have a rash on the knuckles sometimes?
No, they sometimes get red. But,
Yeah?
Yeah, but not really rashed.
Yeah, the,
I get rash
Yeah.
on my fingers from my jewelry.
yeah.
I'm very sensitive.
Yeah.
No, I honestly, it hurts a lot in my shoulders, and then down my arms, it just kind of throbs.
Pain?
Just sore. My shoulders go really bad.
Pain? Your face is pink. Here, it's like that all the time. And the eyes, yeah.
Is it worse during flare-ups, Lil, that pinkness?
No, I notice it every day. Pretty much the cheeks get pink.
Yeah.
Take a deep breath. Okay. Thank you. In the back, where it's worse, in the middle or in the sides?
Middle, and then my hip bones kind of like throb too.
Pain?
More so, it's like kind of in her hip that hurts.
Any pain in the groin now?
Yeah.
Yeah?
Here. Yeah.
Any pain in the groin?
Yeah. Here.
Okay.
Lower back too. Yeah.
I will do one more thing. Let me know if you have pain on the SI joint right now. Not in the back.
Like my butt cheek.
And this one again.
Okay.
I'll do the same.
Yes.
Back. Yeah. Thank you.
Yep.
Do you mind if you take the shoes
No,
off
it's
and the
fine.
socks?
Oh gosh. Do you want me to take off my socks as well? Okay.
Do you live in the same area?
We
Yeah,
live on the same block
road.
for half the year. Then I live in Florida, and I miss my girl, and I don't know how to help her. So I'm leaving November 1st. I want as much help until then.
Oh.
Yeah.
Sometimes it feels like this toe here, for some reason, will sometimes feel like it's like broken, and but then it'll go away.
Is it swollen like a sausage?
I don't really remember it getting
How
really
is-
swollen. It just like gets like, if I put pressure on it, it feels like, ooh, ah. I don't-
And red and maybe warm to touch, and
maybe.
you know, in psoriatic arthritis sometimes patient will have toes and fingers swollen as a sausage because the tendons around get inflamed. You know, it's very
I just get
pathognomonic
this, that
for
swells.
that.
Ooh,
Yeah, yeah,
yes.
yeah. You are inflamed everywhere.
Yes. I don't know
And
why.
you are a very complex case. I think you have more than one thing. I think you have psoriatic arthritis with chronic changes that led to that myelopathy, basically,
Right.
with numbness. And you have these rashes and other autoimmune things, like that coincide with this thyroid also, you know. And you have history in family, you have a lot of other.
Yeah.
So definitely at a risk of getting it.
Yeah.
So I'm done. So you can
Okay,
go back
cool.
to the chair. So you said your mother, right? And what?
My mother has large lumps on her fingers, so I think she has some type of arthritis.
So-
But she's also 92. She's starting to get that.
This only came up a month ago.
This is synovitis, you know, it's from the synovitis. Does it hurt?
And then I get like this little.
Yeah, it's synovitis.
What is tenovitis?
Synovitis. You know, the synovium around the
Oh,
joint
synovial
gets
fluid.
inflamed, right? Not the fluid. There is a, like a
Synovitis.
layer, like we have the lungs, you know,
Okay.
covered by a layer. The same thing. It's in the joint. Each
from-
joint has a layer.
And
Yeah.
is it
Layer
caused
stuff.
by inflammation?
And it increases because of inflammation in
Got it.
size, and you
Got
can
it.
see it,
Got
right?
Yeah.
Got it.
So you are inflamed everywhere.
Yeah.
She does seem to be inflamed everywhere.
Yes.
Flaming
And
walk
she
for
has
life.
and she is laughing, you know, this is good.
She's
Usually-
she's a trooper. She got 3 babies. She's gotta be.
Gotta be.
Little babies.
Yeah, how old?
5, 3, and 2, almost 2.
Wow.
Yeah,
And
exactly.
and this stinks because I really didn't feel done with my family, but now everything's like feeling awful. So I feel like I can't have any more kids right now. And
Oh, you wanted to have more?
yes,
She wants at least one more.
yes, but I can't right now.
So you have boys or girls?
I have 2 girls and 1 boy. I
Oh,
want
so you want one more boy?
Mhm.
She likes even numbers. No.
I just love babies.
I
Ah,
love. She
right.
loves babies,
Yeah.
and she's good at it. You are really the best
Mhm.
mommy
Yeah.
there. Yeah.
Thanks, Mama.
That's good.
Yeah, she is.
Do you have siblings?
I have a sister.
Okay.
Mhm.
In Florida or?
No, she's
No,
in
Buffalo.
Buffalo.
Too far away. Help. I know, it's too far away to help. That's the thing.
Mm-hmm.
When you need help, it's hard.
Yeah. But you don't work, right?
Mm-mm. And unfortunately, my husband's career, he's a contractor, so he travels a lot during the weekdays. So it's just me with the kids at home.
Mm. Yeah. So we will do all of this autoimmune workup. I will check you for thyroid antibodies as well. I'm just curious to see if you have Hashimoto. You know,
Mhm.
I will check the celiac again because of strong family history. I will do the tick-borne disease panel, just take out of the table.
Yeah, take it off the
Then
table.
because you live in
Yeah,
the
totally.
wood area, right? And I will do the muscle enzymes as well. It seems like you have a lot of muscle pain and weakness
Mhm.
as
Is
well.
there any way to also, my OBGYN said before I get pregnant again, she wants me tested for osteoporosis. Like my bones. Is there something I can get done?
No,
or-
it's not indicated to
No.
be tested
Okay.
for osteoporosis at this age.
Okay.
It's unlikely that you
Okay.
have. Unless you have a diagnosis of celiac,
Oh,
then
okay.
it's indicated.
Okay.
Patient with celiac, the insurance will not approve at your age.
Got it.
just but if you have celiac, if you are on treatment, chronic treatment with prednisone for a long period of time, they will approve it.
Okay.
But right now, no, they will not. I mean,
Is it an expensive test?
I don't
Oh,
know.
maybe. I don't
Maybe you can ask.
Yeah,
I
we
don't-
can check.
It depends where you get,
get
I
it,
guess.
yeah.
If you want to have
Yeah.
it done, you can have it done.
know. Yeah.
But-
it's, well, they'll check another time.
Yeah, yeah.
I think that.
And I will do the myositis panel as well. Because I suspect you may have also a disease named dermatomyositis, which is one of the connective tissue diseases that are rare, they are not common,
Mhm.
right? Because of this rash around your
Mhm.
eyes and muscle aches and weakness,
Mhm.
right? And that's why I will check all of this. Have you been tested for hepatitis?
Mm-mm.
I will add it to the lab. And in terms and urine analysis, did you have a urine analysis lately?
Back in February, I think, when I had all this stuff.
Do you have any urinary problems?
No.
No, I will check just to, I'm looking for protein to see if
Mhm.
you have any leaking of the protein, because
Okay.
that could be a sign of kidney involvement in all of these
Yeah.
systemic issues. Um, and because of this swelling, I will check also for abnormal protein in here, make sure you don't have like an underlying blood disorder
Yeah.
or something like that. And you said you have frequent diarrhea, right?
Mhm. Either that or I can't go to the bathroom very well.
Yeah.
Alternating, right?
Yeah.
You have bloating.
Mhm.
And
My
I'll
mo-
check some antibody that if in case they are positive, they will give us a clue if you have inflammation in your bowel.
Yeah.
Different than celiac. Celiac,
Okay.
yeah.
My mother, before she was diagnosed with celiac, because she was just diagnosed at 91, had diverticulitis, and she ended up with septicemia and had to have a colostomy. But she's had, as a woman, an adult woman, she had trouble her whole life with her bowels.
That's
So,
why we need to figure
yeah.
out, and because if those are positive, you may need to see a gastroenterologist
Okay.
as well.
right.
You saw a lot of doctors, but
No, I'm
Yeah.
a walking mystery.
When she was a teenager, she had dysmenorrhea because she would pass out from her periods, and we had her then look
Yeah.
at a gastroenterologist.
okay.
But that was really surprising because at that time, not a lot of women had been tested for dysmenorrhea. But that was a surprising diagnosis
I forgot
because
about
she
that.
was disabled. We'd take her to the hospital.
Because of the pain.
Yeah,
to
we
the-
thought it was an appendicitis. She couldn't breathe. She'd pass out. She would faint. She would
Yeah,
faint. Yeah, it was crazy. It was rough. But luckily that didn't happen all the time. But
It stopped as I
but
like. It was just like the first year or two.
and then when you got into your 20s, it went away.
Yeah.
But Kate was the one that diagnosed us. One of her her older sister's friends.
You know, it's clear to me that you have inflammation in these joints. Would you like a course of steroids for fast relief of your symptoms, at least for 15 days? Okay, yes. And we have to discuss what we can do in addition to that.
Okay.
Because that will not be a solution, as
Right.
you know.
Yeah.
So, given your supposed psoriasis that I don't think, I'm not sure, you know, if you have that.
Yeah.
There is a medication named plaquenil hydroxychloroquine, which is also safe in pregnancy, that I can give for the joint part.
Okay.
But the rash can get worse of psoriasis if this is psoriasis. If it's something different, like dermatomyositis or lupus-like, that will get better with plaquenil, you know.
I guess we'll find out.
So, and there are two medications that are safe in pregnancy, because you mentioned you want to
Right.
become pregnant again,
Right.
right? So this will be one, and another one is sulfasalazine. That will work for the joint, not for the rash though.
Okay.
So these are, if you want to read more about that, I can give you information, and you
Okay.
don't have to decide today.
Okay. I mean, I'll try the one that might clear up the rashes. Maybe it isn't psoriasis.
Well, it's
No.
worth trying.
And if it's worse, it means
Then we know
yeah.
it is.
Yeah.
Yeah.
Start to
Okay.
know.
Let's
Okay.
try that one.
Yeah. And I'm happy that they're safe to take during pregnancy, because I always worry about a lot of these things have really scary side effects. But that's just me.
Yeah.
Worrying about potential, because she's young.
But if
Yeah.
she feels well
But yeah.
while she's pregnant, she may discontinue it,
Right,
you know?
right,
Mhm.
right,
Because she felt well.
right,
in-
right, right,
So,
I
right.
think that's another reason why I want to get
It
pregnant. I
felt better, right?
yeah,
know,
because
it's-
if you control the inflammation,
Yeah.
you'll feel better.
Yeah.
With the pregnancy, the kid will be healthy, you
Yeah,
know?
all the
Yeah.
hormones
Yeah.
flooding, yeah.
So, let's see, so we'll do. At your weight, you need to take 1.5 pill a day,
Okay.
like 300 milligram a day.
Okay.
You have to. Did they advise you to use sunscreen? Do you use sunscreen?
I use sunscreen.
Very carefully, or?
Mm-hmm. Every day. Especially on my face, I do. But then when I'm out in the sun, I wear it everywhere else.
Yeah, because I had melanoma, so we make sure
Oh, so you are
we
aware,
make sure
right?
we have sunscreen on. Yeah.
Mm-hmm.
No, I didn't know then. I didn't know back in the day.
Okay, so I will send this to the pharmacy. I send both to the pharmacy and I'll give you information. You're gonna need to have an eye exam in the first year of the stocking because rarely can affect the eyes.
Okay.
And ask the eye doctor to send me the report.
Okay.
Also, other side effect potential are GI discomfort. It's a oral drug, so take it with food and a generalized rash.
Okay.
And I give you information
Okay.
so you can have it.
If she gets a generalized rash, just over the counter, maybe hydrocortisone kind of thing would help with that, if she gets a rash from it? Or,
Probably have to give her steroids, but hopefully she doesn't.
she doesn't get it, yeah.
You know, it's not that common.
Oh, that's good.
And the cough is just for 1 month, right?
Yeah.
Because if this is persistent, if the dry cough will persist, you will maybe you have a primary care, that, right?
Mhm.
So they will need to do probably more tests, pulmonary function tests.
Yeah.
Now the thyroid is big, so it's compressing in your.
Yeah,
Yeah.
that was what scared me, is she was having trouble talking.
Sometimes I have a hard time swallowing and it'll make my voice go away.
Yeah.
Sorry.
Okay, and you see Dr. Squarta in November.
Yeah.
Okay, good. Let's see, maybe I will add this here.
I know, we'll get one.
You don't.
This is coffee.
Oh, okay.
That's okay.
Get my
That's
coffee.
alright. It'll-
Labs
She likes
and
sweet coffee.
6 to 8 weeks, okay. Hopefully we'll figure out what's going on with
Okay. I know, please.
Thank you, it was a
Please.
pleasure
You're welcome.
meeting you.
Nice to meet
Thank you
you.
so much,
You're welcome.
I'm grateful, thank
Bye.
you. Bye, thank you.
You take a lap.
Okay,
Right.
all right,
Okay.
thank you.